Mhm.
Okay, so thank you for attending today's webinar. Our today's webinar topic is for actually the continuation of the series of the healthcare AI agent. And recently I focus on in relation to digital health, so how they can be converged to synergy. So actually the Rakesh joined last webinar and he asked how I go about the deep dive in a 10 minutes. So
Yeah,
so actually, we try to do more today. So I will share my screen first. So I hope you can see my screen. So
yes.
briefly, that we have four speakers today. Actually, the so Nathan and then Juan and me will follow, and then Rakesh will go over the interact sections. So you can see that. Oh, really a fantastic topic because the this Libby's work is highlighted in the recent in the market map of this kind of like a voice AI agent by famous venture capital. And then Juan will be focused on his company's recent effort to collaborate with some hospital, big hospital in European country. So it's a very rare that you can hear from the real life the expert to how they actually implementing the innovative AI agent for the healthcare application. And then go over very broadly, but what the current state and future directions, and that will be followed by the interact discussion and moderated by Rakesh. Okay, so we'll start from data.
Perfect. Let me share my screen. Perfect. So I know Alex just gave a little introduction, but I'd love to start with just introducing Rivvi. Like we said, healthcare AI is new. There's not a lot of big players in the space, so I'd love to kind of just share a little introduction of what we're doing at Rivvi. We're enabling healthcare organizations to build enterprise-grade AI applications with natural language, so there's no technical expertise required. It really works for the administrators. It really works for the people who want to enable these AI agents. Currently, we're processing over 1 million workflows annually. This includes the full spectrum of workflows that would go into doing outbound campaigns as well as updating certain calls post call. And we're doing about 750,000 patient interactions annually. So to date, we've done close to millions of operations in the AI agent space in healthcare. And what we'd really like to discuss during this presentation is the results we've seen with one of our largest clients. So Southeast Medical Group is the largest independent medical group in the Southeast. They have over 800 or 180 providers, 300,000 patients, 1,000 affiliated providers, and they're spanning 50 locations across 3 states. They're focused on primary care services, so this is a huge variety of services, thus leading to the outbound campaigns they need to do is very vast. We've been doing campaigns for them, such as appointment reminders, medication adherence, a lot of value-based care goes into these agents that we've built for them. So the big problem that we saw with Southeast was all of their outbound was done through Excel sheets and patient schedulers. So their call center team would be given a huge Excel sheet and they'd have to manually go and dial these numbers and call these patients. This causes a huge number of problems, and especially given the scale of someone like Southeast, as you can imagine, meeting the volume demands are extremely hard. So a few of the big problems that we saw is extremely long wait times. Patients would have to wait 8 to 5 Monday through Friday to call to get a hold of anyone. It was an extremely fragmented experience, as well as huge care opportunities and care gap closures that were lost just due to poor accessibility. Excel-based campaign management essentially allows for no actionable insights to be provided. If you do an annual wellness visit campaign, it would be really interesting to know why some patients haven't done their annual wellness visit or what the actual reasons were. So rather than just getting a simple summary from the human agent on how that call went, we're actually being able to log KPIs that mean something for that campaign. So 24 agents in their call center would be handling all of the inbound calls, and they would also be managing all of the outbound calls at the same time. This caused huge wait times inbound, as well as poor data visibility, zero actionable insights, and extremely lengthy campaigns that would happen for outreach. So our solution to this is AI agents that transform healthcare communication. So from manual Excel sheets and a few people, we're now doing fully automated workflows and AI agents to handle this entire process. So intelligent systems allow us to enable rich post-call data capture, which provides actionable KPIs. Like I said, something like annual wellness visits or especially medication adherence. A big thing is calling the patients and getting them to do the desired action is one thing, but getting a good understanding and having actionable insights, especially at the business development level or the care level, it really provides an extra layer from doing these outreach campaigns that are already being implemented. We've been handling over 10 different campaigns. So the call center and the previous outreach methods were doing maybe 2 to 3 different campaigns, like appointment confirmations and stuff like that. With our implementation, we've been able to scale out the campaigns by more than they even thought was possible before. We've done everything from sleep studies to annual physicals to reaching out to patients who haven't came in 2 years. So it really gives us a huge variety of outreach and patient engagement. And patient first design is really what we're thinking at the core is all of these campaigns are really increasing accessibility for the patients and making it easier for the patients, which leads to a lot of these care gaps and a lot of these KPIs that healthcare organizations want to hit being hit faster and care gaps being closed faster just by increasing the accessibility of these agents. And the big thing is context aware patient memory. So when you call a human agent, this agent is not aware of the patient, let alone any of the patient's nuances or the previous conversations. This is completely different with Rivvi. Our agents, our understanding is at the patient level. So when a patient calls in and they had a previous outreach call, that patient would be able to pick up that conversation rather than having to go from 0 to 1 with a brand new call center representative. So it really provides operational excellence. 24/7 AI agent availability is extremely valuable to providers and patients. And unlimited scalable outreach alongside campaigns would take months. Now they take hours. So now it's more of getting all the campaigns we want to do rather than trying to complete one campaign. It's more of they have the option to scale out their outreach volume. So some results we wanted to show was just in 6 months, Tidbit is their inbound call center now does 0 outbound outreach. This actually increased their handle rate for the human call center by 20%. So taking out all of their outbound efforts increased their actual inbound handle rate alongside us scaling their outbound volume. 93% reduction in campaign costs, saving them hundreds of thousands of dollars annually. We saw a 715% increase in appointments scheduled through outbound efforts. So not only is it a matter of volume and meeting the volume, but these AI agents are able to convert at a much higher rate for a lot of these campaigns. And we've 10x their outbound volume, and this is all in just 6 months. So really getting a hold of that is allowing us to see huge results in healthcare and huge results for Southeast Medical Group and especially their patients. So just to give another visual this is kind of what their appointment schedule would look like from outbound efforts before and after Rivvi. And then right here is the call volume. So as you can see, it's continuing to grow and the capacity is just, we're enabling them to reach a far greater patient base than they were previously. Are you guys able to hear this? Yep.
So Nathan, we are missing the voice. I thought you were talking about yourself.
All right. That's what I was wondering. Are you able to hear
Yeah,
the voice?
yeah.
Um, to give a better, I can pause the voice. Um, I'm gonna have to reshare my screen to get the audio to record, but the post-call data here is a very small and brief example of an annual wellness visit, what kind of data would be collected previously through manual outbound outreach efforts, and what that post-call data would look like at a very small level of the entire scope when you're using Rivvi's AI agents. The annual wellness visit campaign is a big, extremely important thing for primary care. And when call center agents, especially agents that are high turnover employees at the call center, aren't really able to meet the needs and the level of empathy with these Medicare patients, they're not really aware of what a medical annual wellness visit is in the first place. A lot of these call center agents, believe it or not. So that was a big issue when we first started, was there's a lot of skepticism about how the patients are going to react, what the level of empathy, and if they want to talk to a robot. But the big difference is we've actually seen the exact opposite here. The patients like it more. It's able to connect at a deeper level, at a better level with the patients, and provide really an experience that you couldn't get elsewhere, especially with a human agent. I think I'm over my time, but just to close off, a little bit of a future roadmap for us is we're months away from unlocking 90 EMR integrations. So, like we said, with these patient contexts that we're storing on a patient level just increases, as well as all of these metrics do when we unlock these deep integrations. And yeah, we're very much patient focused, and we're very much looking to enable healthcare AI agents at scale, which we're already doing with Southeast. So if anyone's interested in healthcare AI, especially at the enterprise level, love for you to reach out to us. And yeah, thank you.
Thank you, Nathan. And next, Juan. Please unmute.
Yes, I sent a request to share my screen.
Yeah,
Yes, okay, perfect.
permitted.
Can you see my screen?
Mm-hmm.
Yes, so I didn't know. So first of all, I introduced myself. I'm a doctor. I did medical. So I was born in Colombia, but I did medical school in France, where I had a diploma of ER medicine. During the medical studies and working as a doctor, I saw a lot of inefficiencies in hospital, and mostly because doctors are requested and asked to do a lot of administrative work. And also in United States, but in Europe, we focus on Europe. 30 to 60% of the personnel that is in a hospital is administrative and not medical, which creates a huge burden on the finances of hospitals. And this is a reality, I think, across the globe. So I saw it firsthand, and then I worked as a chief data officer for a company in Paris that was acquired by Teladoc Health and became Teladoc France. And then I moved to Vienna, now in Vienna, Austria, where we created with my co-founder Healthforce. And what is Healthforce? What Healthforce do is we have created a platform. I don't know the audience savviness in terms of technical. I'm gonna get the boring part out of the way fast. What is a platform and what is the capacity of AI platform? A platform is a system or environment where you put tools that work together to achieve a goal. An AI platform has the characteristics that not only has to be able to deploy and use large language models, but also is capable of managing volumes of data in order to perform actions or make informed decisions. An AI agent, I don't know how familiar you are, but in summary, is a software that has the capacity of plan, gather information, and more importantly, execute tasks on behalf of the humans. And something that a lot of people don't talk about, but it's extremely important in healthcare and regulated markets, is what we call in automation in general, saga pattern, which is what happens when a flow doesn't go well. And you have an automation and you stop because there was a problem. How do you go back? How do you understand what happened, et cetera, et cetera? And this capacity, we don't talk about in general about AI agents, but in reality, when you're working with complex information and healthcare sector, you need to be able to go back and understand what the agent did or why it didn't do it. And this is something that our platform allows to do. So we have clients across Europe. We focus only in Europe. And the reason why we created we created more a platform than a single product is because of the important fragmentation that the healthcare market has across Europe. They don't have the same problems or the same use cases. So we created something. We wanted to create something that you can adapt and put in place in many different countries, in many different languages at the same time. To go very fast, our platforms allows the AI. So the AI agents are just one sector. It connects with all the systems that are across the organization. So the hospital do not require to change any software that they have. And we plug in the agent in order to use the tools that the hospital has. And on top, and something that is very important, and AI agents in general do not perform or well, or is very risky for hospitals or healthcare sector to adopt, is the hallucinations. And in it's very hard to anticipate in the planning phase of an agent what is going to perform. And when you have a multitask, multi-step, multi-system, it's not really reliable to only delegate that to an AI agent. So we have what we call an orchestration engine, which is the one that does the planification, and then the execution of the AI agents are portions of the process and not the whole process, in order to guarantee traceability and what I was mentioning, saga pattern. Also, something that we consider very important is the capacity of the AI and the humans collaboration. What we sell to hospitals is not a solution. What we sell is a digital workforce. You had these people doing this task. Now you can delegate this to another, let's say, a remote worker that now does it with you and collaborates with you in order to achieve the given task. So we have many use cases that we are deploying across Europe. We have, of course, appointment scheduling, but we have also a claim submission. And this is very interesting because you can make two agents collaborate. Because, for example, let's say that you're scheduling an appointment. Of course, that before scheduling the appointment, you need to check that the patient has prior authorization or has agreements from the whatever, So the capacity of the agent to interact with another agent that takes care of this second step of the process, but is different, is something that we are able to deploy. How do we deploy this in our hospitals? So we have the orchestrator, which is the equivalent for the people that has medical knowledge. The prefrontal cortex is the motor part that decides what you're going to do. So when you're going to say play piano, your brain planifies what the fingers are going to do, and then you play piano. So this is our orchestrator. An orchestrator sends the signal to the systems in the hospital in order to perform a task that, of course, is very complex most of the time, which then performs the task in coordination with what the orchestrator decides. So this is really the brain of the operation. And we have, of course, connectors or ways to interact with humans regarding what the task needs to perform. In the case of so for example, if the patient needs to do appointment scheduling, so you receive a link and then you can interact, so the patient can interact, but we can send also for the staff of the hospital some information and request some new information that the agent requires in order to perform the task end to end. I forgot to say that we work with large hospital groups across Europe, and all the countries that I mentioned, we work with among the top 3 or top 4 hospital groups. So we have hundreds of hospitals under coverage. The task and so something that hospitals and in Europe have is that they are not elastic in their expenditures. So they require that you prove ROI very fast. And this is the reason why we have deploy agents that are only ROI positive for our customers. So we have contact centers, as I mentioned. We have patient access or patient intake. We have also revenue cycle, but it is passive and active. So for example, the purchase orders that the hospital needs to send to providers. This is an example of what we call an automation blueprint. So it's our capacity to create what I was mentioning, like a partition of that you want to play. So we have the piano, which is our infrastructure, and the partition that you need to play, which is the task that needs to be performed. And we have multiple of these partitions and workflows that we can deploy across a country, for example, when it's required, or in between countries when we see an overlap in the operations. Yes. So at the end of the day, what we are paid for is to actually perform the task on the system. So our agent connects with the system and performs the task as a human, as I was mentioning. You have in front of you an example of the speed and the accuracy of the agent, and the fact that we do not require APIs from the hospital. We do not require integration from the hospital. We go directly into working on top of the existing systems. Last but not least, of course, our platform ensures security and compliance, which, as you know, is very important in healthcare. And our compliance is across Europe, so we can work with all the European hospitals. Compared to Nathan, I cannot disclose most of the numbers regarding the performance of the agent, but we have been able to automate between 80% and 96% of tasks for our customers, and these have saved tens of thousands of hours for each customer that we have, and the flexibility, the versatility of the task and operations that we can automate have proven to be very efficient in order to really multiply our work across Europe and the fragmentation of the market that requires this versatility.
Wow, fantastic. Wow, a lot of progress. Yeah, because before I heard from you and before actually I just counted how many actually the actual real life use cases happening in all of the world, and then you're almost done in European country.
Yes,
Yeah,
yes.
fantastic. Okay, so I will start I'm going to go over like more broad scope and focus on in integration with the digital health, that what the current status and future aspect. And then I'm going to introduce what I'm doing, my own innovation, like AI agent and converse with the digital health. So I will share my screen first. Okay, so what I'm going to talk about today is first, you know that almost all of you are my LinkedIn connections. So if you look at and I post a lot of things related to AI agent digital health. So I've been 30 years in almost in tech area, and then by some reason for 1.5 years I've really deep dive into digital health area. And then I've come with the idea that because I'm familiar with the AI before, not just in healthcare, in all aspect, and then I know about the AI agent. There is a very like it's a coming up as a very hot topic, and then suddenly I have a lot of my learning curve for the healthcare tech, AI in healthcare and digital health was growing. I found that two sides should be converged, because that's why I'm initiate this kind of series of the webinar, and also try to invite the global like leaders in this space. And also I'm doing my own research and my own innovation. So if you I have a lot of the videos in my YouTube channel. It's about the 10 years of the history that I have done in all aspects of the emerging technology. And recently I was to create my own like article site on the topic of AI agent digital health. So you can look at it in Medium article, you can see that. Okay, so I briefly go over what the current status. So as I mentioned, that I 1.5 years, I really deep dive into what the current status and what is the future direction of the digital health. So the first time that I approached was to look at the startups because they are innovator. So they're reading this ecosystem. So first I try to figure out that what is the ecosystem component of this one. So I just look at what is the ecosystem healthcare. So in the center is a hospital and patient, right? And the usually patient usually stay in home, so hospital home, and then surrounding them as you talk about medical activities means that the interaction between doctors and patient. So there is a diagnostic part and also like monitoring prevention and prediction and therapeutics. So this is all traditionally there is exist a traditional diagnosis, monitoring, prevention, therapeutics. I'm looking at the digital counterpart. So there is a AI powered digital diagnostics and remote patient monitoring utilizing like IoT sensors and digital therapeutics, evidence-based like a software medicine, like a software that as a medical device. And so there is a like a real life like evidence generated and then telemedicine and home care is a space. And there is a supporting space like research and drug generation, so drug discovery, clinical trials, search. So I look at this is a very evolving space. So I look at the detail about this, what their innovation and what their business model looks like. And then I finally made like some accumulate, and then I just published like what this. So I in my book actually you will see all this startups profile, right? So what they're doing, what their innovation product, what are their pathway. For example, some company require like clinical trials, or the FDA clearance, what are their fundraising status, something like that. Here is a funny thing. Here is one thing related to AI agent actually. You know that I really like handling a lot of the information, right? So actually, what I did was I just made some my own algorithm to how to do more systematically, automatically. So I made my own. It's a you can think of it as like a group of the prompt utilizing my ChatGPT. So I just done this kind of thing in like more than 1 year, and I have made a systemically. I have my own platform can do this analysis and provide like even like very like expert like writing. Right, this is my own platform. I one time I think about maybe I can like commercialize this one because this is fantastic. Because for example, that if I want to research some company or industry, and I have my own platforms. I put in some instruction, it automatically generate up to this book. And then I found that recently the big company like the Open AI, they they call like a deep research. And then I found that I tried that because you know that there is a part of the like 200 like a premium service of the ChatGPT. I found that what they're doing is very similar to what I'm done. So actually, I developed my own agent to do my own research. But anyway, so this is a history. So this is the one actually my first like development my research AI agent, the handling all kind of like information analysis for me. Right? This is a definition like they use like a perception. So I just instruct that I want to do this. It's understand, my agent understand. And I want to know about what the current status. So you need to find out the relevant information. And then I ask him, and then it just accumulate, analyze, and then provide the analysis. And then I ask about, please use your memory to link with the previous search, something like that. I just made like my prompt engineering, and then they can use. So it's the same thing, right? Because agent use memory and then reasoning, and then what he's doing, I ask about, okay, so provide a profile of the specific company, and then to make like a very professionalized writing, right? It's act. So this is one concept actually that I developed my own agent, but it includes every component of the agent, AI agent. You can see that actually you will see that. So I just generate this bunch of the book, and then even I also analyze patent. I'm a patent attorney in the United States. So what the innovation sectors, I look at particularly I was very interested in T-cell therapeutics. So they are very directly related to the patient cure, care. So I look at this space and then I analyze about the 200 patent. I do the same thing. So because I analyze a lot of patent information, and one patent usually 30 pages or 50 pages. And then initially I manually done everything. And then after I found that I can do more better way. Right? So I just made my own agent to analyze the pattern, and then I ask about what the critical innovation, what their digital therapeutic mechanism of substrate, and my agent can provide the answer. And based on my research, I just published this book. So I also use AI agent because this is a hint that, well, you find out a very useful case is using your own research or your thing. So I think the most popular application in healthcare is healthcare research. That's related to, for example, clinical trials, drug discovery, and innovation. That's what I'm working on. So I published some books, and here I organize a lot of the webinar, and then I accumulate all the information and put in as an article. And then also I'm interested in how to make this ecosystem as a mainstream. So I have a lot of the initiative I'm working on it. And then AI agent. So I already explained what is AI agent, right? Because this is one thing. They understand the environment. They understand like, for example, I'm an owner because I'm oversight this agent. So my agent, tools I have developed my own agent. They understand my intention, perception, and then there's a brain. For example, I'm using ChatGPT. So ChatGPT is a large language model. So they have a brain. They have a recognition, and then using their memory and then perform something, analysis, gathering information, and then do something, and then act. I ask about provide me good text, right? Provide me good what? So this is the one thing, right? So I already developed, so I very understand what this mechanism looks like, even before that I look at this one, because I just I understand what is the definition of the agent, but I found that it needs for my proposal and then develop my own agent, and I found the same thing. And another thing, so architecture maybe. So you think about what kind of architecture you need to find out. The most important is that what kind of like agent types and their characteristics. This is very important because agent cannot be universal, right? For example, agent can do this, agent can. No way. Agent has very specific purpose. So whenever you design agent, they have very, very specific goal and design goal and the purpose, right? So there is different type of agent available. And then this is a good like categorization of the so I've just noticed that what kind of like agent will be particularly relevant in healthcare. So this is kind of like reasoning, right? So it's kind of like research. So they are very good like biomedical research, the drug discovery, clinical trials, and what I'm doing now. So this is the one thing, and then reg is if you're a technical guys, it's just to guarantee some accuracy. So like to try to utilizing outside information. For example, I'm using for me, I also use leg like a component. I'm not because I'm not cannot control my ChatGPT, but I know about how to include reg. Do you know how? Because reg is just to look back your what you have in is a correct information you use. So my reg, I use my prompt engineering. This is one example. You can use your reg your way. So what I'm doing is whenever I ask to ChatGPT, okay, so I'm interested in what kind of like a cure like a therapeutic for Alzheimer, for example. I'm very interested in Alzheimer disease, and then And then first, ChatGPT looking at the because of initial training or the over the training. For example, I use my or many times use so all kind of like my all the history is there. And additionally, what I'm doing is search website to find out the resources actually can support your reasoning. Right. So this is the same thing, right? Even if I don't make any very rigorous way to rank, but this is the thing that you can make more better way to utilizing your ChatGPT. So what I'm doing is I conform utilizing outside information, whether the provided by ChatGPT is correct or not. And then another thing is self-learning. It's very important, right? Because self-learning is maybe not this time, maybe used in the healthcare, but they are very. I think that I found that they're very important in the future application, especially their related to medical activity, like this is a supporting system or the some kind of supporting what kind of current for example to what is the best way to treatment plan or something like that. They needed something to learn from the interaction of the patient and doctors, and that they provide a more better way. So these two type, I found that I'm now doing some another research about all kind of different type of the this agent, and then try to figure out the use case and then how they actually can apply healthcare. So that's one of I'm now doing. And then also you need to think about whether AI agent, especially if you're interested in healthcare, then what kind of things you should be considered. And then here that they are not focused on healthcare, and that they are very reluctant to apply AI agent, right? So to healthcare in the previous two speakers talk about is to be little bit the risk free because for example that if that space moving to directly to medical activities, right, like for patient doctors interaction, and then relate to like a cure, diagnostics, and prevention is a medical activities. And then you know that if you do your device AI do something kind of this kind of medical activity, they categorize as a medical device. Usually, if they are AI and software, they call software as a medical device under FDA regulation. And then you know that still FDA is not ready to accept this kind of application utilizing AI agent, that kind of activities, right? I will explain that. My next webinar will be who will be liable, right? Because very serious problem. And then you know that, and then like a large language model is not perfect yet, and the AI agent is not perfect yet. So very careful about what kind of application you really can do. But my hope that in the future, right? Because the technology are all evolve and innovate. So I hope in the future will be cover even that space. That's what I'm doing in the visionary way to how actually can do in that medical activities. So I just look at what the current status, and I found that about 30 more they're doing some the most of the thing that you need. This is a think about that why this area it is rare because of the risk factor, right? Because it's very risky to apply some specific healthcare application, especially in the digital health related medical activities, right? So most of the application now is in the administration efficiencies and clinical practice, like operation and something so related to like a patient care side or the having the doctor or something like that. And then you already heard about, for example, this. I contacted them because of my own analysis. I found the two companies are actively working on in real life application, and then I found that there are several other companies already done in this space to actually collaborate the healthcare institution to implementing this healthcare agent in action. And also last webinar, I introduced a bunch of the big companies are now entering into this space, and then they announced all this year about the huge like collaborate effort to like initiate with existing like healthcare companies doing that. And one of the like this is one example is Oracle is one good example is Oracle is that is one of the tech giant and they have a cloud service. They're very active in the software engineering. And then recently they found that in the healthcare space and that they already some done like actual life the application in here. And also like there is some, for example, I'm in Boston and here is Harvard Medical School, Mass General Hospital is very strong in the research bound. And this is from the Harvard Medical School article. So they are very interested in utilizing this AI agent in the biomedical research. Okay, so then this is one how to actually implement this one. So this AI agent is not just like for example hospital operations administration, but I'm interested in how they actually can be like interact in the actual like medical activities I'm interested in and then other area actually that I can contribute. So I just generate bunch of the article because of the I contacted from the many people about their interesting to apply agent to their field and most of the contact that I found that they're interested in clinical trial because clinical trial require the handling huge amount of data. So, and then they are very like depending on the data, right? So, and then there are many process actually require the complex process to handle it. And then they need to a lot of the analysis done. So I found that the clinical trial is one of the best place and the risk very low, right? It's just clinical trial, right? It's not directly, maybe, but not directly to involve in the like a patient care directly. So this is one. Another area is a drug discovery. So in the drug discovery, they are also handling huge amount of data. For example, the a lot of people are interested in drug repurposing. So drug repurposing means that they're using a lot of the already proven like a drug compound, the molecules, the method exist, and then people are interested in to find out like a combination or refining something that to find out a new application of the existing drug. They call it drug repurposing. And this space is good to apply a agent because they can have a lot of the data and analyze and to propose. For example, I can and in here to also like they utilizing very because usually most of the AI is black box. So, but they want to be the reasoning how actually find out this kind of like a combination of this kind of like new drug proposing. So this is one place actually that they're utilizing like explainable the XAI techniques. So in combination with XI and agent, they want to be very like clear reasoning how to find out the new discovery in drug discovery. So another thing that you can think about in my article, there are a lot of people are interested in other areas, especially mental health. And so this is one thing that I did. So I'm not going to talk about this one, but what I'm doing is that I found that a lot of the like activities, innovation in digital therapeutics innovations, and I found that some framework how to actually develop your own DTX based on input information like a patient profile and what's your goal, outcome, and then what kind of like digital means you want. So input put in there, and then it will generate a bunch of blueprint that you can use in your like a new like a DTX innovation. That actually I just shared that I can do in the real life demo actually developing ChatGPT. So I'm going to share in the next my webinar. And also like this is another one software like if you have a drug and then if it's more effective there is a software supported like a reducing side effect and then adherence or something like that. And I found that there is the same mechanism. So I developed this one. And another thing is very important is like in the FDA clearance space, So you want to be approved through the FDA, and then you need to file a lot of the like data, and then you need to understand a lot of legal document. As I'm also like a lawyer, so I found that this is a good price AI agent can have, right? Because they understand legal document, they can translate plain language, and then have to like people to how to actually the pathways through the required approval processes, something like that. So this is my all my innovation is to patent pending because I'm a patent attorney. So I found recently I found that this application directly apply. You know that the Trump administration actually they lay a lot of the government officers. And one of the problem was that they lay a lot of the FDA peoples, and then they are ready to like approval of this very important digital health product. And then I just like I because of that I already done this kind of thing, right? So I know about how to handle it. So I recommend the FDA should apply this kind of AI agent internally and have to do because there are a lot of processes very repeated and automatic. So they can do this through the AI agent. And then this is one actually that I actually how to apply AI agent directly to patient care in addition to like operation efficiency. So this topic I will raise in the next time. So this is another one that I want to be put into digital therapeutic as a mainstream workflow. And the problem is that if you have a good digital therapeutic, no non-doctors can apply, right? Because of the no system, right? Because they don't know how to like including the DTX as a part of your like a patient treatment, how they actually subscribe, even they don't know about how to integrate the EHR. So actually I collaborate with my partners to develop this whole system. One of the key using the AI agent is because of they require the evaluation. So they only evaluate the high quality DTX should be include this kind of like healthcare workflow. So we are under developing how AI agent, we made some 10 type of the different type of how to evaluate your the DTX. And then we just analyze how to implement an AI agent. And currently that we are focused on mental health because this is the one that actually uniquely reimbursed through the CMS code. Okay, so I'm done. So I require you have to the collaborate this side. And then this is one actually the my next one we will deep dive into mental health. And then as a lawyer, there was a lot of people, especially a lot of people are interested liability of this kind of like AI agent, do something missing or like malpractice. As a lawyer, I'm very hesitant to do some legal thing, but a lot of people are request too. So I'm not sort of partner. I'm eventually saying what or IP issue like who owns the IP when developed by AI agent or something like that. So although and I recommend to our previous webinar series that cover all aspects of the AI agent.
Right?
Okay, so I'm done. Rakesh, your turn.
Yeah, thank you so much, Alex. Great. As we can see how a steady advance of AI agents in the healthcare industries, really great discussions that we just heard. And I would like to invite you, if you have questions, please drop it into the chat pod. I'll be looking into that. We have received 3 questions so far. And about the recording of these sessions, it will be available as soon. It will be available soon, I would say.
Yeah, yes, I will send
Yeah,
you if I have an email list, and I will
yeah,
send you.
yeah.
And usually I just have a record of the email list. I have up to now I have more than 1,000, so I will share it. And
Yeah.
another thing is that just to look at my LinkedIn, and then I will post it. So
All
either
right, so we'll do that. So Alex, I'm just going into 3 quick questions because just we have 11 minutes. I'm not sure if there are more coming, but I still have some questions of my own. So the first question is from Elena. Has Rivvi tackled acute triage using their AI agents?
Yeah, I saw that question. So our
Yeah.
focus is actually on making healthcare more accessible with streamlining communication, administrative tasks, things like scheduling, outreach, everything that patients have to navigate outside of that visit. We're really focused and really believe that that's where AI will make the biggest impact in healthcare while leaving the clinical decisions in the hands of the healthcare providers. So short answer is no.
Okay. All right. Just going to the next questions from Ananta. This is for Alex. Which frameworks or tool you use to create your AI agents?
Oh, I just use ChatGPT, but you can use any large language model base, right? So the large language model is the train to learn a lot of the information, right? And then I retrain. So you know that there is a one shot, two shot, right? Because you understand what it is. One shot is like zero shot means that just ask ChatGPT anything, right? And then you guide your instruction like I need some specifically provide is one shot, two shot. I want this, and additionally, I want, right? Because you have a more sophisticated, you will have a better
Mhm.
answer, right? But you need to design it, right? So
Mhm.
I use my understanding of the large language model and utilizing the prompt engineering to so I think that there are two sides. One is that the large language model capability, one thing very important. Another thing is users, how to use it. Right. For me, I'm very expertise. And 1.5 years, I use ChatGPT at least 5 hours a day. So I'm very expertise in prompt engineering. So how to use it? But anyway, I'm using ChatGPT up to now. But
Yeah.
I'm thinking about another one because,
Yeah.
for example, I'm going to have a discussion with Google tomorrow. So I'm asking about their platform maybe available for my research.
Yeah. Yeah, so Ananta, you're right. It's what you mentioned. It looks like it's almost prompt-based agent creation. So yeah,
Yeah,
maybe
or
that's another way.
you know that there are like a lang chain or other things. If you really have
Mhm.
a
Yeah.
skill about your Python or whatever,
Yeah, yeah. So I think there are two options available. If you are a non-technical, then maybe makes more sense. You have agents available that you can create using this kind of tools. Even deep research is available. This is also an advanced level of agents. So going to a next, I think let me go back to questions to Nathan because there is one more questions. Are these samples of your agents on your websites?
Yes, there is
Okay.
samples of, I believe, 8 or 9 different campaigns with complete voice logs and recordings that you could listen to right now.
Great. Right. There is still one more questions for Rivvi. Can Rivvi also supports bidirectionals, EMR, data review or entry?
Bidirectional EMR, so yes. So what we're currently building with the EMR integrations that we're working on will allow bidirectional sync with the EMR. So once again, we are storing this patient context throughout all these conversations that can be applied and also be aggregated with the actual EMR data as well. So these agents will be able to take full action in the EMR, making everything extremely seamless from updating their information, their insurance, to booking an appointment.
I see. Great. Great answer. And I think Ananta has questions which is regarding how do you envision AI agents that can help in drug discovery. But what I believe the two or three, all of three, maybe this is more related to Alex in a sense that because currently we are more talking about operation efficiency, which is scheduling, claim submissions, and various kind of surveys that needs to be done by the hospitals. So drug discovery is something, an area, not sure who can answer, but I lean to you, Alex.
Oh yeah, maybe I'm not directly like involved in drug discovery, but I think that I know about the general rule of how to use AI agent. That's why I'm involved in
Mhm.
because once I understand like a drug like a discovery process, then I can find. But this is a general rule, how I develop my own agent, right? Because
Okay.
agent can do something for you, right? First, but very like a time consuming manual work required, right? For example, that I developed my DTX platform because initially I found that wow, this kind of like a framework can develop new DTX. It's maybe the drugs is the same thing. Like first that I found that the old like a digital therapeutics based on traditional therapeutics, right? So for example, that if you want to cure the mental health, and then I found that they are not from the from 0 to something. They bound on previous good therapeutics, right? For example, in the mental health, they call CBT, like or under like mindfulness. So they're already existing therapeutics, and then I found that. And then at first, I what I did was manually try to find out to analyze what kind of like therapeutics exist and what actually they call the doctors prefer to use. They call standard of care. So standard of care means that it's well defined by the clinical trials and evidence base, and then among the doctors they accept it. Right, because it's recognized as a standard of care, so they recommend use this to treat their patient doctors. And then I'm very interested in I'm not familiar, I'm not very good at in the medical, like I'm not doctor or whatever. So what
I
I did
can
was
chime in, Alex, there. So just to remember back in 2024, early, like first or second quarter, there was a seminar from Merck, the vice president of Merck, and they actually did a really great work. Like I have seen the demonstrations, and they were on one of the major announcements on AWS and Microsoft. They actually did a drug discovery time, which used to take 2 to 3 years or maybe up to 10 years. They have compressed to the 2 months. So I have seen that. I don't have a link right now, but I will be happy to share with you once I find it.
yeah,
Maybe
yeah. So
that,
so
that could
so
be make more
yeah, basic
sense.
principle is that you find out your
Yeah,
problem, right?
yeah,
And then I
yeah,
found that I'm doing manually. I search and then analyze and look at all the
mhm,
information myself manually, and I
yeah,
found that whether I can use AI agent for me
yeah,
to right. It's idea because agent most powerful purpose they can search
yeah,
and they gather data and analyze and
yeah.
provide answer what I ask. So drug discovery is the same thing I think about because
Right.
the fundamental mechanism is that the treatment mechanism, like you have some particular targeting disease.
Mhm. Yeah.
And then how actually the molecular can the chemically interact or whatever, right? So there may be some mechanism. And then what the people now doing is that they manually research what are the complex of the molecule or something like
Yeah.
that. But I'm asking my agent, looking at all the molecular space existing, right?
Mhm.
And then
Yeah.
find out the relevant molecular structure can be applied this. And they provide the list of the candidate I can apply. For example, simple agent, but they can do, right? So,
Yeah.
but it's that's what I call multi-agent system because
Mhm.
I don't want to be one agent can handle everything. So for
Mhm.
me, that I like make some framework, and then I provide like a specific test to some one agent for this, and then I combine as a multi-agent. So yeah, drug discovery. Yeah,
Yeah.
probably you will have an answer for me. Yes.
Yeah, Alex, maybe this is a much deeper topic, but
Yeah.
yeah, I think this is can be implemented. Ananta, I will give you a moment. I know you want to speak, but I have a question. Like Huan, I have a one or two questions. Maybe this can help. So you mentioned that there is no integrations with EMR or EHR. Then how do you do this? Like in your scenario, the platform that you have created.
To me, this is
Yeah.
a question. We use it depends on the tool that we're using, but now we use the traditional RPA, but only the portion that interacts with the system. So we imitate the actions from the human. So we log in, we
Mhm.
enter the systems. But for example, in order to make it more efficient, if we know that, for example, we need to schedule the calls for tomorrow, we
Yeah.
connect at 4 a.m. in the morning, extract the patients that are going to come tomorrow. We save that for the memory of the agent, and now the agent has access to that information. But how it got gathered that information, it like a human would do it. In
Right.
that way, we don't need the interaction. If the interactions are there, if the integrations are there, we use them. But traditionally, I know that the United States is much more connected, but in Europe, EHRs are famous for being very closed in order
Exactly.
to
It's
avoid.
here. Same thing.
Yes, so
No
if we
different.
ask for integration, we can wait for 16 months.
Oh,
So
So,
of
follow-up
what.
question, Juan, on that. Like you said, you use RPAs. So
Yes.
your agent works through RPA to
Correct.
interact with this kind of system.
Correct.
Is that
Exactly.
okay? Got
Exactly.
it.
So it's like,
Mhm.
as I mentioned, it was the agent has the brain and tools, right? This is
Yeah.
traditional. So would consider RPA a tool for an agent. So the agent decides that it's going to do something,
Mhm.
and if that something it interacts with another system, that system become the tool. But we don't let the agent be more than just an in and out.
Yeah, totally. No, that's interesting. I know we are almost top of the time.
We can maybe
Th
just
there are
finish more, right? Because a lot
there
of
are still
things.
some questions. I mean, if you guys can stay, because I hope Nathan and Juan, you are available just to answer some of the questions which we still have. So Ananta is asking like, what kind of LLM model do you use? Juan
Uh,
or Nathan?
I can answer after Nathan.
Yeah,
Maybe
yeah.
Nathan can.
GPT-4o mini.
Okay.
We've used every single LLM model that you could possibly use, and we've just seen as far as cost and efficiency goes, especially with these long tailing calls and multi-step flows that OpenAI and GPT-4o mini right now has been the most efficient LLM model that we've used.
Okay. Great. And Juan, one last, sorry, you want to add something
No,
on
yeah,
your
so
side?
we
Yeah.
we don't we because of obvious reasons we cannot use GPT because of the European
Yeah.
constraints. So we use Claude, but we are of course now trying to do distillation of models because there's no point of having an LLM to do a specific task that is very constrained in terms
Mhm.
of execution requirements.
Mhm.
So we are based on the data that we're gathering using large language models. We will train and we will distill the models in order to perform specific tasks, which will reduce enormously the latency, but more importantly, will create a moat and also will create IP. So I'm thinking about Alex. I will create IP
Okay.
regarding these models. Yes.
No, that's really great. And I believe like Mistral is also seems to have performed very well in the healthcare
Yes,
industry.
Mistral is
So yeah,
exactly. Mistral
yeah,
would be an option, but
yeah.
in all the tests that we have performed,
Mhm.
Mistral underperforms compared to other systems.
Right, totally. All right. I know. Can I ask one more question? Maybe this is for you, Juan. So you mentioned you have a platform, you have a main orchestrator or piano. So if something like that makes all the other agents work, now what happens if one of the agent fails? Like, do you handle the failovers by your orchestrator, or
Yes,
like how do you?
so correctly. So one
Yeah,
of the magics that what we sell, what we offer to our clients, and
yeah,
what differentiates selling agents in compared to traditional software is that we do not promise that we're going to solve 100% of the problem.
mhm,
So if you think about it, when a human has, let's say that you hire an intern, right? Or you don't assume that the intern is going to do the same work as you, but it's going
mhm,
to alleviate your workload. So whenever the agent faces a situation that it doesn't know how to handle, it's just by default delegates it to the human. So the human receive an email saying, "Hey, I tried to do this, I couldn't. Can you take over?" And then if the frequency of this takeover is elevated, we do
mhm,
a quarter review with our customers, and we teach the agent how to do it. So the delegation
yeah,
reduces over time, but we don't try to overcomplicated the process since the beginning. We try to do it in iterations in the 80-20 rule, meaning we want to deliver 80% of the value at the beginning and the remaining is the, and just I want to be fast, but if you look at it as the autonomous driving, I mean, I know that it's an unpopular name in the United States right now, but it is what it is. Elon Musk says when you go from 0 to 60 in automation is easy, but the more incremental 60 to 61 is
yeah,
10 times harder than 0 to 60. And
Mhm.
every time that you increase 1% in this kind of complex process or situation is exponentially harder. That's why we don't overpromise, because we know that reaching 95% of automation will require 100 times more effort than reaching 80%. So we sell the 80%,
yeah.
and over time we will deliver more value, but this is not what we overpromise to our customers.
No, that's fantastic. Like you have a resume button, and the human can pick
Oh,
it up from
Juan, and
that.
then I
Yeah.
have a final
Yeah.
comment actually that
Yeah.
we also see the problem with the integrated EHR system. A lot of our innovation is related to integrated EHR system. So, and I'll let you know that my partner, she was a previous former exec vice president of the Meditech. Meditech is the second largest vendor behind like Epic. And then we have an expert group related to EHR. So if you have anything related to EHR integration, then we can collaborate.
Of course, yes, of
Yeah.
course.
Yeah.
As I mentioned, the collaboration with the EHRs traditionally in Europe has been an uphill battle that we try to avoid altogether through the systems I mean, if they, and also we believe that as soon as we have a market share that is significant, the negotiation power that we will have for the platforms will be higher. But yes, so in summary, we tried, I mean, we want to collaborate with them, but we don't need to collaborate with them in order to deliver value to our customers.
Okay.
Okay. All right. So that brings us to the end of today's webinar. A huge thank you to our speakers, Nathan, Juan, and Alex as well, for sharing their wonderful insights. We also appreciate all of you for joining us and engaging with us. It was great talk, really great questions, and we look forward to connect with you in the next seminar. So, Alex, thank you so much.
Thank
You
you.
very much. Thank you
Thank
very much,
you.
everyone.
Have a nice
Yeah.
day.
Okay.
Have a
Thank you.
great one.
Bye-bye.
Yeah. Yeah. Thank you for being with us.